This segment is sponsored by VCU Health.
The doctor is in and you have questions. And while many people are eager to get vaccinated against COVID-19, others do remain hesitant, certainly uncertain and unsure. This is natural, but it also could pose a risk. To achieve herd immunity or community immunity, 70 to 90% of us will need to be vaccinated. Dr. Jeanine Guidry, the director of the VCU Media+Health Lab, joins us today. She's here to talk about vaccine hesitancy. Jeanine, it's great to see you.
Glad to be here with you today.
Jeanine, we're learning so many different terms and philosophies, and vaccine hesitancy almost speaks for itself, but there's a lot surrounding this. Can you describe a little bit of a definition for us and talk us through why this is a problem?
Yeah, vaccine hesitancy, it basically means either a refusal or a delay in getting vaccines when the vaccines aren't available. So you're choosing not to get it when you can. And it's a particular issue with COVID-19. Obviously, we don't have all the vaccines available yet that we want to have available, but that's in process pretty fast. The problem is obviously that COVID-19 is a deadly disease. We have lost close to 500,000 American lives, not counting everybody else around the world. And it's a deadly disease. And really, we have two ways to get through this pandemic. Number one is prevention by staying home, social distancing, wearing our masks. And number two is reaching herd immunity, community immunity through vaccination. And in order to do that, like you just said, we need to reach between 70 and 90% of us vaccinated. I'd like to see us more to the 90% just to be sure. And you can see that if people are choosing not to get the vaccine, that's a potential issue.
So overcoming this vaccine hesitancy is key. How do you approach that? How do we wrap our arms around that?
I think the first thing that I try to do is approach it from a place of empathy. People who are not getting vaccinated, who are choosing not to get vaccinated, don't do it because they want to hurt people. They do it because they're concerned. And so I think the first thing to keep in mind is come with empathy. Find out what people's concerns are. There are a lot of different reasons why people may be concerned about a vaccine. For COVID, for example, it could be that this vaccine was developed very quickly. It's a miracle. It's absolutely remarkable that we were able to do this. But it makes some people concerned that maybe corners were cut. And let me just reassure everyone watching, they weren't. There were other things that were sped up, primarily in the way things were paid for and the speed with which things were developed. But the vaccine itself was tested as rigorously as any other vaccine. Some people are concerned the vaccine is not safe or that vaccines in general are not safe. This vaccine is safe and it's effective. And we've seen you can get some mild side effects, have like a sore arm for a few days, feel like you're coming down with something. That's actually a sign that your immune system is working. This vaccine is a safe and effective vaccine, and communicating that with people. We've heard some things about people being concerned the vaccine could have an effect on fertility. We have no indication at all that it would in any way be related to fertility issues. So that's a wonderful thing to reassure people about. A harder thing, I think, is that there are some racial disparities in vaccine access, in vaccine acceptance, and one of the problems is that people of color are more likely to be seriously affected by COVID. And so if they're also less likely to get the vaccine, that's a problem. It's absolutely understandable because we have a history of not dealing with these things very well. But I think the most important thing to realize is this vaccine is our way out of the pandemic. This is our way back into a more normal environment. And I think those are some of the things to address when you're talking to people who are less sure about getting this vaccine.
So, Jeanine, overcoming vaccine hesitancy in terms of from how would you approach this? Now let's ask the question for viewers watching today, what can they do at an individual level to address this hesitancy, vaccine hesitancy?
I I think one of the most beautiful things right now is that a lot of people who have gotten the vaccine already are really helping with this by posting selfies when they get the vaccine, by sharing their stories, by sharing how excited and happy they are that we're able to have this public health measure and this really miracle to help us get out of this pandemic. I think as people see that their peers, their neighbors, their family members get the vaccine, that they're excited to get it, and that if they have any side effects, they're mild side effects, that is a real encouragement. And I think it shares on a very human level that this vaccine is safe and that this is something that we do as a community, as a society. The other thing is we can be mythbusters. If you hear that someone is saying something that is not true about this vaccine, a piece of misinformation, so to speak, refer them to reliable sources. CDC, Virginia Department of Health, VCU Health, and VCU have great sources as well. And the wonderful thing about those sources, they're continually updated. If there's new things we find out, they are updated and the information stays at a level of the best things that we know.
And Jeanine, great insight. We're out of time, but I do have one last question for you. You're playing this role at an individual level, certainly of overcoming vaccine hesitancy. You have not yet had the vaccine, but you are serving as a vaccine champion. Can you tell me just a little bit about that?
That's correct. I am not in tier 1A and 1B, so I'm not eligible yet to get the vaccine, but I have registered with my local health department, and I will get the vaccine as soon as I'm eligible. Very excited about that. And in the meantime, I try to educate people and let people know what this vaccine is, how it's going to help us, and how we can all play a role in this, not just protecting ourselves, but protecting those we love.
Sharing some great information. Thank you so much for taking time today, Jeanine. We appreciate it.
You're welcome.
For more information and to learn absolutely more, visit vcuhealth.org/vaccine champion. Stay with us. We'll be right back with more Virginia This Morning after this.